שלום, שמי גיורא שרף, ואני המקים של עמותת חליל האור, שחליל זה ראשי תיבות שחולי לימפומה ולוקמיה. זה למעשה הבית של חולי סרטן הדם בישראל. אנחנו נמצאים בסן דייגו בארצות הברית, בכנס האש, שזה הכנס ההמטולוגי הגדול ביותר והחשוב ביותר בעולם. ונמצא איתי, and I have the pleasure to host my really good friend, Dr. Brian Koffman, who is tell us about himself.
Well, Shalom Yor, thank you for inviting me and giving me this opportunity to talk. So I'm Dr. Brian Koffman. I'm a family doctor. I'm not a hematologist, but I'm also a CLL patient myself. And I'm here at ASH 2018 reporting on this. I'm the Chief Medical Officer at a not-for-profit charity to help other CLL patients called the CLL Society.
Great. And you are helping a lot of patients because I see and I hear, and you know that we meet in many meetings, and I know exactly how helpful are you to and other. And you had the pleasure yesterday, had the pleasure to be in a ceremony where you were awarded the CLL Hero, and you received a special award for all the work you do, which is really admirable. But you also have a special story. And can you tell us a little bit about your CLL history?
Sure. So I was diagnosed with CLL 13 years ago. And to understand that 13 years ago, there weren't all these wonderful new therapies that are available to now. I say to patients, there's never a good time to be diagnosed with CLL, but there's never been a better time because the treatments are so much better these days. So I was diagnosed 13 years ago, and I felt some little lumps on the back of my neck. And I wasn't too worried about them, a cyst or something, ordered some blood work on myself, had an elevated white count, couldn't believe that I had cancer. Found out just a couple weeks before my daughter was getting married. And as you know, in the Jewish tradition, if a funeral and a wedding reach the corner at the same time, the wedding takes precedence. Choose life over death. So this was a very difficult time for my wife and I because I had very bad prognostic factors. At that time, my life expectancy was really just a few years based on the evidence at that time. And we kept quiet because we didn't want to ruin the wedding and everything like that. And then I told my family afterwards, and my CLL advanced relatively quickly. I had to grow a big beard to hide my nose. And one day I was actually at a retreat for Rosh Hashanah Yom Kippur, and I noticed I was bruising easily, and I had little red dots on my legs and stuff. So I ordered, being a doctor, I ordered some blood work on myself. They said the doctor who treats himself has a fool for a patient. So I ordered blood work on myself, and I was on call, and I remember I said, I got a call. I said, Dr. Koffman, we have a critical lab level on Dr. Koffman. And my platelets, which prevent bruising and bleeding, which should be over 130,000, were 9. So I ended up in hospital, had multiple admissions. I had to have my spleen removed on an emergency. I had multiple bleeding. I went on to have a bone marrow transplant because that was the only potentially curative therapy at that time. So I'm in my mid-50s when all of this is happening and hoping to live and see my other children get married and give me grandchildren. And there weren't any great treatments on the horizon. So I started to tell a little bit of my story, and my kid said to me, Dad, this is so old-fashioned, writing emails and calling people, set up a blog. So I set up a blog, and because I was a physician and I could explain things, it became extremely popular. And people followed my transplant. Sadly, my transplant didn't work, and I relapsed quickly afterwards. And then I got into a phase 1 trial of a new drug, a very early drug called PCI 32765, which later became ibrutinib. And I told that story, and my blog became even more popular. And now I was coming to the major hematology meetings and interviewing doctors and reporting on what I was doing. And the blog is very chronological in the way it tells the story. And it became clear, some patients needed more of a horizontal approach in terms of they don't even know what a lymphocyte is. They don't know what a lymph node does. So we set up a not-for-profit to explain what was going on so people could start with very basic information. What is leukemia? What is lymphoma? What does the spleen do? Things very basic, but also talk about advanced things in terms of what's a checkpoint inhibitor, all the new treatments and stuff that were out there. So we put together the CLL Society as a website. We attend all the major conferences like here at ASH. We do a lot of advocacy to help patients get better access to their drugs, not just in the US, but around the world. We've set up 29 different support groups across the Canada and the USA for patients to talk to each other and support each other. We do educational forums. We do major research. We have a paper we're presenting tonight, which is the largest survey ever of CLL patients. That'll be, so we're hoping to influence how hematologists treat CLL patients. So the blog has become even, the blog has sort of fallen in comparison to the not-for-profit, because the not-for-profit is where we're putting all our energy in trying to help patients.
But what is happening to you with your CLL? So you had a transplant, you relapsed, you started the trial with ibrutinib.
So let me get to the dramatic part. So I went through ibrutinib, and I was very blessed to have about 6.5 years of ibrutinib, 7.5 years. And then it was clear that I was starting to relapse. And the relapse is slow, and it gave me time to plan stuff. So my Dr. John Bird, who was leading that trial, talked to me about my various options. And there was a lot of difficult decisions to be made, because generally people who fail after ibrutinib fail after a bone marrow transplant. I'm chemo-refractory, chemotherapy wouldn't work for me. Don't have a lot of great options. And there was a trial at Seattle Hutch of CAR T therapy. So CAR T therapy is a cellular therapy, still experimental in CLL. It's a gene therapy where they take my own T cells. These are the soldiers, you know, in the immune system. They take them out and they re-engineer them to attack the cancer. So they take them out of you, they grow them outside of you, they put them back in you, and then they attack the cancer. And that's what I had done at Seattle, CAR T therapy, chimeric antigen receptor T cell therapy. And it was a very difficult time, extremely difficult time. You go through.
When did you have it?
So I went up to the Seattle Hutch in the end of February. They do something called leukapheresis, where you have a needle in one arm, a needle in the other arm, and they take your blood out of you, they spin off the T cells and put the rest of the blood back into you. Then they use that to manufacture the CAR T cells. I had that early in March. Takes a couple weeks to manufacture them, make sure your heart's okay, your kidneys are okay, and then I got the CAR T cells. And that was kind of anticlimactic. Really nothing happens. It's about 20 minutes, a little bag, it looks like tomato sauce, you know, it doesn't, you know, nothing really happens. And then you hope that you get a little sick, because that means the cells are expanding and starting to do their work. And I got a little sick, and I got into hospital, and I had fever and aches. It was like a terrible flu. And if I can share this, this was over Pesach, over Passover. So I had a rabbi come over, and we had, you know, Passover Seder and stuff like that. It was very, very sweet. So I was well enough to do all of that stuff. I wasn't feeling great. I wouldn't want to, you know, go for a long walk in the park. I was really quite sick, but I got over that. I went home. And then home being a hotel that we were staying at in Seattle. And then several days later, I started to get stiff, achy. I got much, much worse, to the point where I couldn't move. And my wife had to call an ambulance, take me to the hospital. They had to lift me up. I was screaming in pain. I eventually got toxic, where I was hallucinating. I couldn't see things. I was on opioid narcotics around the clock. You know, I had to be catheterized to urinate. I developed a blood clot in my lungs because I couldn't move. I was all swollen in my legs. Anything that touched me hurt. I was in terrible, terrible shape. It took a while to figure out what was going on in terms of this, but eventually they gave me some medications, some dexamethasone, a potent steroid, and a drug called tocilizumab, which turns off the T cells that are causing this inflammatory reaction, and I got better. But I had to learn to walk again. I was walking with a walker. I was sent back with a wheelchair. I mean, all of this I had to go through. But the good news was, then they restaged me a month later.
And you were clean of cancer?
Clean of cancer. There was, so down to 1 in a million cells in the bone marrow, and and now it's 6 months later, and I'm still clean of cancer, and I have no cancer in the blood, the bone marrow, and I have persistent CAR T cells still playing whack-a-mole with the cancer.
But I'll ask you a question which maybe you haven't been asked. You did a bone marrow transplant, and you did a CAR T cell. Both of them are not an easy procedure.
Right.
Which one of them was more difficult?
Good question. So for me, because of the complications I had, the CAR T was much more difficult. I mean, with the transplant, you throw up, you lose your hair. What do I care? You know, I mean, the hair grows back, the vomiting stops, you're okay. I felt tired and crappy for a while, but the CAR T was much, much more difficult for me. It's not that way for everybody. For me, it was, yeah.
Yeah, but you are somebody that we all look up to.
Oh,
and
thank
you
you.
are an example for a patient and an advocate.
Right.
And all I want to wish you is a lot of health.
Oh, thank you.
Keep in touch. We'll remain good friend. And remember that I'm waiting for you in Israel. I want you to come and tell your story to our patients.
I will. We'll set up a time, you know. Thanks.
Thanks for coming, Brian.
Thank you. And
you.
and I just want to put a push that I'm alive today because of entering 2 clinical trials. The first was for the drug that became ibrutinib, and the second was a CAR T trial. And if it wasn't for those, if I'd followed conventional therapy, we wouldn't be having this conversation. Thank you.
I'm happy you did.
Yeah, thank you so much. Great.